Right now there are something, depending on who you talk to, between 4,000 and 7,000 chemicals in the smoke that people exhale, in the secondhand smoke, and many of those items are carcinogenic. If your next door neighbors are non-smokers and you continue to smoke in your apartment, you could be making them sick. You could contribute to all sorts of diseases that they might contract. You could even contribute in some way to their death, because secondhand smoke kills. And we talk about the fact that the smoke doesn't know where it's supposed to go or where it's not supposed to go, and that there's no way to be safe about that.
In 2009, the housing authorities were notified by HUD, which is the Department of Housing and Urban Development, our major source of funding, suggesting that housing authorities consider a smoke-free policy.
I received a phone call from the executive director of the Providence Housing Authority asking me to attend a meeting. And the meeting was about smoke-free housing, and really didn't know much about it. So I attended the meeting in Newport, Rhode Island, at a hospital there, and I met with health professionals as well as people from a housing authority in Maine. And the theme of the meeting was stopping smoking in public housing units themselves, opposed to just the general areas of a building. So I ended up getting quite a bit of information at the meeting. I brought it back to the executive director, and he asked me to poll the rest of the managers that work at the agency to see how they felt about stopping smoking in some of the developments. And ultimately, I think it was sort of a negative opinion of people that it'd just be really a difficult thing to do, hard to stop people from smoking, but ultimately the executive director said that he wanted to try it in one building, and he selected a building that I manage. And so I ended up talking to him a little bit about it and how we could implement it and all that. And ultimately, we ended up a smoke-free program in all the housing authorities, elderly high-rise buildings.
The funding for the smoke-free policy originally came from the Centers of Disease Control, and then funneled down to the Mayor's Substance Abuse Prevention Council and the Department of Health. There were other sub-awardees like the Providence Housing Authority, such as the Providence Community Health Centers. There was Advocacy Solutions, which was the marketing piece of it, and community-based organizations. So there were many, many sub-awardees that came together and met monthly and worked together very, very well.
It was important to enact a no smoking policy because for public health reasons. I think it's beyond any reasonable doubt now that smoking is harmful to the health, not only to the individual smoking, but through secondhand smoke to other residents in these buildings.
But also the cost to the housing authority, which is something that probably I didn't consider that much, but once I saw some of the numbers on paper, it's like, smoking causes the walls to turn yellow in apartments and smells to get in carpets and fires that happen in the kitchen, people falling asleep in bed and, lighting the place up. So all those issues were there, and it sort of made sense that as a landlord, it's really a good idea to implement, a smoke-free environment.
And for me, working at the Providence Housing Authority, I've noticed that we're always one of the first in line to implement policies, to take on challenges. The mission for the Providence Housing Authority is to provide healthy living conditions for our residents, and a smoke-free ban will definitely do so.
Put together a task force of key people in the Housing Authority, including myself as Executive Director, our legal team, some of our site managers, and our resident service coordinators. And we meet occasionally to discuss policy and to look at how well the program's being implemented.
The Housing Authority's task force was formed as a way for all the staff to be involved with implementation and to identify any problems that we had and deal with them so they didn't get out of hand. So it brought in different people with different expertise to talk to staff about how to implement it, what are the best things, to do with people, how to encourage people to come, and then let them know what our problems were, so we're all around the table at the same time.
My role was to not only research what a smoke-free policy was and what it meant to the Providence Housing Authority, but to incorporate our residents and our communities into that research. there is an issue with smoke-free public housing, and it's what's talked about on the news, and if you look into articles, it's what's talked about. Do residents have the right to smoke?
And then they came to me and asked me to look into the legalities, and many questions came up, obviously, and months of research went into creating policy and lease addendums and things of that nature, and researching tenants' rights, smokers' rights, and non-smokers' rights as tenants.
In the beginning, I was against the smoke-free policy. I felt this was my home, this was my place to live, and I felt that why should somebody tell me what I can do in my own home?
But for people that's been a good tenant, living here for 15, 20 years, and they didn't have any intentions, it didn't even cross their mind to quit smoking, and then one day they come and say, well, this is going to be smoke-free, you're going to have to stop smoking. I just don't think it's fair.
In my research, I found that smokers are not a protected class. So the American with Disabilities Act, it does not, they don't have to follow any, they don't come under that guideline. But on the other hand, non-smokers, if we didn't institute a policy like this, non-smokers could actually sue us if they were to get effects from secondhand smoke, for example, which was very interesting, because many people thought that they have the right to smoke in their own home. But when you're in public housing, you know, many rights are limited as to what you can or cannot do.